Hi, I'm Dr Nick Fluck, Medical Director for NHS Grampian.
And I'm Dr Caroline Hiscox, Executive Nurse Director for NHS Grampian. These are unprecedented times. In response to COVID-19, our NHS faces the greatest challenge in its 71-year history. It's a challenge we will be able to meet as we work together across health and social care and adjust to these changing circumstances. Before we go into further detail about particular measures for staff in Grampian, we would like to echo the comments of the First Minister and the Cabinet Secretary for Health and Sport. You are our greatest asset. Please take comfort and courage from each other as we work together to manage this situation.
The NHS in Scotland has now been placed on an emergency footing for the next 3 months. The priority across the country is to increase capacity, especially in intensive care, to reduce delayed discharges, and to consider testing for frontline NHS staff to ensure you do not isolate unnecessarily. Boards have been instructed to suspend non-urgent elective procedures. We are now working on identifying which patients will remain on waiting lists. Urgent treatment and cancer care remain an absolute priority. You should have received today, either directly or via your line manager or team leader, information on what to do if you become symptomatic or live with someone who is symptomatic, or are currently pregnant, over 70, or have a chronic health condition. To reiterate the guidance as it stands today, for people who either live with someone who is symptomatic or become symptomatic themselves. Now, specifically, the recommendation is that individuals have either a fever greater than 37.8 or a persistent cough. If this affects you, we would like you to firstly contact your line manager and let them know you are in this group. Then arrange to leave work and return after this period of isolation. Record your details on the form that was attached to our communication and send that into the Human Resources Hub. Or ask your line manager to do that for yourself if you don't have access to a computer. If you are symptomatic, you should start 7 days of home isolation as described on the NHS Inform website. If you're a contact of someone who's symptomatic, you should be isolated for 14 days. Please look after yourself and your family. Stay contactable so that we can update you as further guidance is developed. Now, if you have a chronic health condition, and the examples of this are people with long-term respiratory disease, long-term cardiovascular disease, or are currently taking or receiving immunosuppressive treatments or receiving treatment for cancer, it is important that you also contact your line manager and let them know you're in this group. You then should contact the Occupational Health Service for a proper clinical decision to risk assess what is the most appropriate action for you. If Occupational Health is unable to assess you on the day you contact them, in discussion with your line manager, you'll need to make a risk-based decision as to whether to go home immediately and then contact Occupational Health Service after this. Please follow the OHS guidance, which will also be communicated to your line manager. Record your details on the form that's attached to our communication and send that in to the occupational health team, or ask your line manager to do this on your behalf. Again, please look after yourself and stay contactable.
For ladies that are pregnant and for our workforce that is aged 70 and over, the advice is similar. Contact your line manager and let them know that you are in either of these groups. Arrange to leave work and return only when you're advised that it's safe to do so. Record your details on the form that's been sent out and send it to the NHS Grampian HR Hub, or ask your line manager to do that if you don't have access to a computer. Follow social distancing advice as per the NHS Inform website. Specifically for women that are pregnant, if you have any concerns relating to your pregnancy, please speak to your midwife. Look after yourself and your family and stay contactable, and we will be in touch through the details that you've given us on your form. If we need to change any of this guidance or when it's lifted, we will communicate with you all. Please consult today's email carefully, as it also contains contact details of HR and occupational health, as well as a list of some frequently asked questions. Finally, thank you again for all that you do. The coming weeks and months will not be easy and require a rapid reconfiguration of our services, which is now underway. By working together, I am certain that we will get through probably what represents the greatest challenge of our lifetime.